It's a beautiful day for a run. Things are really lining up for me right now. But I need to push it a little bit harder. The qualifier was just 2 months away.
I've been told I have atrial fibrillation. What happened?
Well, the risk factors for atrial fibrillation are a little bit different than for your regular heart disease or coronary artery disease. So in your case, your risk factor is partly your age, but also partly that you've had a history of a lot of exercise. Funny enough, that does have an increased risk for incidence of atrial fibrillation. The regular incidence in the population is about 6%. So there's kind of a sweet spot for the amount of exercise that's really good for you. So there's sort of this great J curve where too little is not good, too much is not good. There's a nice sweet spot in the middle that's just right that gives you all the health benefits.
If I push myself too hard, what are the risks?
Well, the risks when you push yourself hard to get that heart rate working upwards and excessive can put a lot of strain on the heart muscle trying to pump. So you're at risk for stroke with that. So some people that have atrial fibrillation are put on blood thinners to minimize that risk. I have a good friend, Bob, who's experiencing some of these things, who's been a exerciser, a lead exerciser in the past that's got this condition, and he's learning how to manage quite well. So perhaps we can put you in touch with him.
Hi, Gary.
Hi, Bob.
Hi, nice to meet you.
Nice to meet you. Come on in.
Hi. Yeah, Ann mentioned that you want to start a new lifestyle.
Yeah.
So one of the things she suggested to me was possibly increasing your warm-ups and cool-downs.
Okay.
Got a place we could warm up?
Let's go.
So Gary, Ann mentioned that you need to adjust your lifestyle. Your symptoms aren't all that serious. Good thing you caught it early.
Yeah, I guess so.
So Gary, one of the first things you need to consider is your nutritional plan. Cutting back on caffeine is probably important. I prefer decaffeinated tea myself. The second point, Gary, is to cut back on all that high-intensity training that you do. It's recommended that not more than 80% of your total training is roughly at your lactic threshold, which is about 85% of your maximum heart rate. Thirdly, recovery. That's probably the most difficult thing to do. Lots of sleep, and you know, we're not getting any younger.
Don't I know it?
So Gary, let's go for a slow run.
Okay.
Remember, don't train hard, train smart.
All right.
Okay.